A virus is another type of organism, and they're very tricky. They're very, very tiny, even compared to bacteria. They're very tiny. And they're like master spies. They can go inside a cell, infiltrate a cell, and take it over. So viruses are very common, right? Again, we talked about the cold viruses, but viruses are also things like the flu, influenza virus, HPV, human papilloma virus, which can cause cervical cancer and warts and things like that. You have herpes virus, right? Cold sores, chicken pox, HIV, right? A very common virus that most of us have heard about. So these are all kinds of viruses. And there's also other things that Allah's created as well, and on small scale like fungi and other things. So these are all microorganisms. So viruses, they usually need to survive in something, some kind of fluid, whether that means blood or sexual discharge or respiratory secretions, right? Our nasal stuff, fluid from our lungs, all that kind of stuff. So they have to survive in something. That's why things like HIV spread through blood, right, for example, because viruses need to survive in that thing to pass from one person to another. So why is this called coronavirus? So if you can see over here on the screen, it looks like the virus has a little crown around it, hence corona, right? I'm not sure which language, is probably Latin, but that's why it's called coronavirus, and then a much nicer looking picture, right? So it looks kind of cute, but in reality it is dangerous. So why are we scared? Why is the media going crazy about coronavirus? Why are hospital systems taking all these precautions? Why is everyone so scared about COVID, right? And I'm going to keep saying COVID because the media always says coronavirus. Again, that's kind of a misleading term, right? We're talking specifically about COVID. So why are people scared about COVID? So that's because it's kind of started out of nowhere, right? It started in Wuhan, China. It came all of a sudden and it spread very, very quickly. Right, it spread very quickly in China, and I'll show a map soon showing about how much it spread around the world. And from China, it's been spreading pretty quickly in Italy, South Korea, Japan, and in the US. It's actually spreading a lot in the US now as well. So that's why people are very scared, and also because people have been dying from this. So people have been dying from coronavirus, dying of viral pneumonias in the ICU, and that's what's making people really, really scared, and also because it's very contagious. Right? Some people say, at least some of the infectious disease specialists at my hospital have been saying that it's about twice as contagious as the flu. Right? So it's very easy to catch, and that's why it's spreading very quickly. But there are other coronaviruses that have been in the media and that have scared a lot of people in the past. So you have SARS, right, which also started in China. You have MERS, right, Middle Eastern Respiratory Syndrome, which started where? In the Middle East, right? So the difference between SARS and MERS is that they were much more difficult to actually get, right? For example, MERS, you had to actually like hang out with camels or be exposed to a lot of people with it, like in an emergency room or something like that, in order to actually get MERS. Otherwise, it was very, very hard to get. And that's why there was no MERS epidemic in the US. People weren't freaking out about MERS. It was in the news, we heard about it, and then we probably went on YouTube and watched some video and forgot all about MERS, right? And then the common cold, right? Again, like I said, the most common coronaviruses that we've had are the common cold. So what is death rate, right? We always think about death rate, and that's what scares people. So when we talk about MERS, the death rate was around 30%. So about 1 in 3 people who had MERS would die from it. That's a very, very, very high death rate. So coronavirus, it's tough, right, with COVID, because it's very new, and we're still doing a lot of studies, and we don't fully know exactly what the death rate is. So early reports have said 2%, maybe 3%. So how do you come up with those studies, right? So say I have 4 people here, right in front of me. One of them has coronavirus. I tested all of them, and they end up all having coronavirus, right? So 4 people with coronavirus, 1 person dies. What percentage of that was that? 25%, right? That's a big death rate, right? Now say all of us in this room right now, we all have a cough and a runny nose and stuff, and I didn't test anybody else. I just tested those 4 people, 25% death rate, right? But say now, hypothetically, I tested everyone, and everyone here had coronavirus, the same COVID we're talking about. What would that death rate be? Much, much lower, right? So again, we don't know, but they're saying 2%, 3%, some say 5%. We don't know for sure, but experts are now saying it might actually be less than 1%. And that's something the president has also said, probably not based on scientific evidence, but still, he's actually right that it probably is less than 1%. And inshallah, we'll see in the future, once we have more data, what it really is. But 80% of people have mild disease. They have the common cold, those kind of symptoms, they get over it, and then that's it, right? They don't even know that they had COVID. So 80% of people, mild disease. So even though the media is focusing on all the people who are dying about this, and dying and going to the ICU and all of that, we have to keep in mind that most people are going to have this and not even realize and get better. So this chart that we see here, I know it's a little hard to see, but it's showing us on, and walk over to TV over here, it's showing us different kind of viruses that we've seen, throughout history, right? Things like Spanish flu, MERS, SARS, measles, polio. The farther you go on this line over here, that's how easy it is to get something. For example, measles. If I had measles right now and I sneezed, it could spread 100 feet, right? That's mad far, right? You can go all the way probably to the end of there and everyone in this room could get measles, right? That's really, really infective, right? Measles doesn't kill as many people. People do die, obviously, but the higher up you go here, that's the death rate, right? That's how many people die. SARS is pretty deadly. MERS, very deadly. Right now, as far as we know, we're somewhere in this area with COVID, right? So it's pretty infective, a little bit more than the flu, right? Not as bad as measles, not as bad as smallpox. And then how deadly is it? Again, somewhere in this range. It may be as bad as the Spanish flu. It may be the same as seasonal flu, right? The influenza we always get, the one we get the flu shot for. So we don't know for sure, right? We're still waiting on a lot of data and a lot of studies that will come out, but that gives us an idea of exactly what we're looking at, right? And that we're looking at something not as bad as SARS, not as bad as MERS, but something we have to be wary of and be careful of, but not freak out about. So COVID worldwide, right? It started in Wuhan, China. It spread to South Korea, Iran, Italy, Japan, and it's in Queens, right? There actually are cases in Queens right now. There's cases in Long Island Jewish, there's cases in other hospitals in Long Island, in Nassau County. So it is here, so we do have to be careful. And again, it spread very quickly, right? And we'll talk about incubation period soon, right? An incubation period will explain why it spreads suddenly, right? You see 2 cases, 3 cases, and all of a sudden it increases. For example, in Italy, 2 weeks ago, there were about 130 cases. And now there's well over 8,000, I believe. You'll see the map. It's well over 8,000 in Italy, right? It spread in 2 weeks, it exploded. That's because of how infective it is, and also the incubation period. So if you look at the map, right, we're looking at the countries that have COVID right now. So the red ones are the danger areas, right? China, South Korea, Iran, and Italy, right? So Italy has 9,000 cases. China has 80,000 cases, right? And there's reasons to explain why. It spread very quickly in China. It was kind of ignored by the government for some time, so it really got dangerous. Alhamdulillah, the cases are actually slowing down in China now. They're taking very, very, very strict quarantine measures, and China's cases are actually going down. I think last I read it was like 99 cases in one day, which is very low, given the thousands they were having before. But we can see in the US, this was updated as about maybe an hour and a half ago, 2 hours ago. It's a little over 600, over 600 cases, right? Yesterday was 500 when I checked around the same time yesterday. So it's going up. But 50,000 people worldwide and counting, this is as of March 5th, have recovered. So people are actually getting better, right? Most people recover. So then we have to be careful. We have to take our precautions, right? And we'll talk about precautions coming up. But we can't freak out about this and go into a mass hysteria and start panicking and buying everything in the store and shutting ourselves in our house, right? It's not the time for that right now, right? We have to live our lives, take precautions, and be careful because most people are going to recover. And you're actually more likely to get the flu. Even now, even in March, we're still in the flu season, which is why it's important to make sure you get your flu shot, right? Because your flu shot will help you either prevent getting the flu or prevent you from having as severe a flu. Right? So it's very important that we still get our flu shot, and we're still more likely to get the flu. But the good news is all the precautions we're going to talk about and how to be careful with COVID will also protect you from the flu. So how do you get COVID? Right? So it comes from respiratory droplets, like we talked about, right? So it comes from when you cough, when you sneeze, all of those kind of things. When you come from there, that's where COVID comes from, and that's why it spreads. People breathe it in, and then they get the disease. So coughing, sneezing, right? Runny nose. Those are the main things, right? The common kind of cold symptoms that we all have gone through. And that's a picture from the CDC, actually, of a guy sneezing, obviously. And then you can see, look how far that thing has spread, right? When someone sneezes without covering their mouth, that thing is like a rocket coming out of your mouth. And those little droplets, each droplet has virus in there, right? It's hanging out in those particles, waiting to go to somebody else, right? So that's why it's very important that we cover our mouths when we sneeze. Because if we don't, imagine I did that right now, and all of that went everywhere here, right? That huge stream of stuff is going to go over everyone here, right? So it's very, very dangerous. And that's why the simplest precautions are sometimes the best. Cover your mouth. What are some other ways we can get it, right? You can't get it from the Quran, right? But you can get it from books, right? You can get it from the actual physical mushaf, right? Someone sneezes, they don't sneeze in their elbow, they sneeze in their mouth, they go and touch the Quran, and then maybe 20 minutes later, maybe an hour later, someone else comes, touches their nose, they can get infected. Same thing with a subway pole, right? That's probably one of the dirtiest objects in New York. You know how many people touch that thing every day, right? So I've been paranoid about that for many, many years. But now people are kind of getting wind of it and being paranoid too, because there's so many germs on that thing. And measles, right? If I had measles and I sneezed on this thing right here, it can last for 6 hours, right, on this object. So 5.5 hours later, after midnight, someone comes and touches this, they can get measles. We don't fully know yet how long COVID can live on an object. But some coronaviruses, maybe a few minutes. Some coronaviruses can actually be days. So we don't know yet, but we have to be extra careful because it could potentially be many, many hours, maybe even longer than a day. So that's why whenever we touch objects, we have to be careful not to touch our face. It can't pass through the skin, right? So if we touch it, it's not going to get into our skin, get into our blood, into our lungs, right? It doesn't work like that. It has to get into our nose, our eyes, our mouth, right? So that's why if you touch stuff, you can touch things, it's okay. But make sure you wash your hands well, and we'll talk about that as well. Another thing is doorknobs. Faucets, right? Anything that's commonly touched by a lot of people. So what is an incubation period? Does anyone know what an incubation period is? Any biology majors? Anyone in the healthcare field? Good, right? So it means, so you have the virus, right? Someone sneezed on this thing, I touched it, I touched my nose, so now I got the virus. But I may not realize that I have it for up to 2 weeks. People say it may only be 5 days, right? Maybe within 5 days, most people seem to be showing symptoms of COVID, but it could be up to 2 weeks. And that's why some of your workplaces, my hospital system, for example, if you're in a high-risk situation, they quarantine you for 2 weeks, right? That's why. So that means while you're in that phase, you may not be having this crazy cough, this crazy sneeze, all of that stuff, but you can still pass the virus on. Right? It could be in your saliva. Maybe you have a little bit of runny nose and you just wipe your nose, wipe your nose on your hand and touch something in the grocery store. And it can stay there, right? Even though you don't have major symptoms, it can actually pass that way. And some people have what you call asymptomatic disease. They may actually have the disease and not spread it. They may not actually have any symptoms at all, ever. They just get over it and that's it, but they can still spread it. So that's what we have to be careful of. And there are cases of someone who's seen a patient with COVID in a hospital setting, right, as a healthcare worker, who's actually had it asymptomatically, no problem, they felt fine, they gave it to their husband, and now their husband is extremely ill in the hospital, right, on a cardiac monitoring unit, right? So this stuff is very real and it's very dangerous, and this 2-week period is why you're seeing it explode. Because there may have been 130 in Italy of 2 weeks ago, but during that time, thousands were actively getting infected. 2 weeks later, they're showing symptoms, being tested, and now it's well over 8,000, right? So that's why it's dangerous. So what are the symptoms? Again, same thing as the common cold. Fever, cough, sneezing, trouble breathing, right? You have a runny nose, sore throat. But the most dangerous thing with COVID is pneumonia. And that's what we're really, really worried about, is pneumonia. So why are we worried about COVID as a pneumonia? Because people get pneumonia all the time, they get some antibiotics, and usually they get better, right? Unless you're really old or you have some other problems going on. Most people get over normal pneumonias. So why is this one such a problem? Right? Can you just go to the doctor, go to the hospital, get some antibiotics, and get over it? Right? Who knows? Should I start calling on people? Let's see some activity over there.
Antibiotics don't work on viruses?
Good, right? So antibiotics, they don't work on viruses, right? Viruses, there's really no treatment for most viruses, right? So when you get the flu, when you get the common cold, you can take medications to help you feel better, to help with your congestion and your cough and all of that stuff, but there's nothing that'll actually cure or go and fight the virus and get rid of it, right? So that's why the pneumonia is very, very dangerous, right? People have the upper respiratory symptoms, the cough and the cold symptoms, but when it gets deeper into the lungs, then you have a dangerous problem. That's when people are in the hospital and intubated on life support and things like that. So recovery, as far as we know right now, again, this is kind of a very rapidly developing situation, right? A few weeks from now, we may have completely different information, even a few days from now. But most people get over it in 2 weeks. If you have severe disease, maybe 3 to 6 weeks. And they've done studies in China, and in China, 80% had mild disease. I think it was around 14% had more severe disease. And then it was only like 5 or 6% that had really, really severe disease, where they had to be in the hospital and intubated and all of that stuff. Right? So again, most people have mild disease. So who's really at risk? Right? Elderly people. Right? Their immune systems are much lower. Right? Their bodies just aren't as capable as they used to be. Their lungs may be weaker. So elderly people, definitely at risk. People with a low immune system, right? Some people have immune disorders. They're born with problems with the immune system. Some people have had transplants, right? And they have to take medications to help with that. But their immune system is low. As a result, they're also at risk. And then people with severe chronic conditions. So when they were looking at China and trying to figure out why did so many people in China get affected, and especially a lot of men got affected and went to the ICU and died, if anyone has been to China or known about China, there's a lot of smoking. Yep. I'm like, yep, okay, a lot of smoking, right? The air is terrible, there's a lot of smoking. These people have lung disease, very common there. So the lungs are already impaired. They get this COVID, and COVID loves that. They want to go and hang out in the lungs, and these people are in serious trouble. So these are the people we really have to worry about. So if you have anyone like this in your family, be extra cautious. So how do they test for it, right? So now they're getting more and more testing for it, and it's usually through nasal and oral swabs. So they swab in your nose, they swab in your mouth, right? Get some fluid and then send it over for testing. So our hospital system this week is starting to roll out more tests. That's the Northwell system, and all other hospital systems are doing the same. So again, if you feel like you have these symptoms, don't go to the ER. I'll talk about this again later, but do not go to the emergency room. There's a coronavirus hotline, which I'll give you at the end. Many of us may have doctors, may know doctors in the community. Consult with someone with medical knowledge and see whether you should get tested or not. So the CDC gave us some guidelines as to who should be tested. And this was maybe a few days ago, right? Before the testing is becoming more widely available. And the government has said now that anyone who wants to be tested can be tested. So we'll see how true that becomes. But as of now, if someone has had known contact with someone with COVID, so you definitely had someone that you were in contact with, they had COVID, and now you have a fever, or you have some of these symptoms, right? The cough and the sneezing, the trouble breathing, then you should really consider getting tested. That's important. If you've been to any of these affected areas, especially Italy, China, South Korea, and Iran, and you have either a fever, or you have a fever and you have these symptoms, so a fever, a cough, a runny nose, sneezing, again, you should call your doctor and seriously consider getting tested. The last category is people who have a bad pneumonia, they're hospitalized, they're really, really sick, their oxygen blood levels are low, and doctors can't figure out what else is going on. They should check for COVID, especially now because it's spreading in the community from people who didn't travel anywhere. So there is no cure, right? There's no vaccine. And they say they're working on a vaccine, but anyone know how long that's going to take? Could be years, right? They're right now saying at least a year, right? Allahu Alam, but we're not looking at any time soon. These vaccines take a long time, they have to do trials, all that kind of stuff. So there's no cure, there's no vaccine right now. So the main thing is to rest and drink fluids, right? Everything our mom and dad tell us, right, when we're young. Rest and drink fluids when you're sick, right? And that's really the best way to get over this virus. And you can take medications for your cough and for your sneeze to make you feel better as well, and that's what will really help get you through this. If you're feeling worse, you have a cold, it's been not going away for a few days, you feel like it's really getting bad, you're developing a fever, you're getting like trouble breathing, then call your doctor and don't go to the emergency room. Why should you not go to the emergency room? Say again? So it could make you worse, Or, astaghfirullah, if you have COVID, even if it doesn't make you worse, you're going to give it to everybody else, right? Everyone who's sick is going to run to the emergency room. Free distribution, yep, free distribution of COVID, right? The kind of gift nobody wants. Yep. That's like the kind of dawah you don't want to give, not that kind of dawah, right? So don't go to the emergency room, right? If you call your doctor, you call the COVID hotline, they tell you to go to the ER, fine, then you're following medical advice. But on your own, if you're worried, seek someone who has medical knowledge, and they have this hotline, this national hotline to call in case you don't know anybody and you're worried. So that's where we should be going first before we start freaking out and running to the ED. So what about masks, right? People have a lot of questions about masks, right? Should we be wearing masks? How come we're all not wearing masks now, just in case? So if you're sick, you should definitely wear a mask. Remember that guy, the picture of the guy sneezing? If he had a mask, some stuff probably still would get out, but a lot of it would be blocked, right? So that's why if you're sick, definitely wear a mask. If you're not sick, do not wear a mask, right? That's so far what experts have been saying.
What about niqab?
Well, I guess niqab, if from a religious sense, if you want to wear niqab, that's definitely good. And Allah will protect some stuff from coming in, probably will. But if you're feeling well and you're feeling good, do not wear a mask. Because again, these droplets are really, really tiny. You can't even see them. So if you're wearing one of those green masks, right, one of those kind of masks, and you get the virus, it's going to come in through the mask over here, underneath. It's going to come in. You're going to get it still. It's not going to help. And even worse, your mask kind of falls off. It feels a little weird. So you keep touching your face to try and get the mask adjusted. How many more times are you going to end up touching your face, right, and potentially infecting yourself? So do not wear masks, right, unless you are sick. Has anyone heard of the N95 mask? Right, they talked about it in the news, right? We've been using it in the hospital for a long time, usually for people with TB and people who have airborne illnesses. And airborne means that even if someone breathes on you, you're at risk of getting the disease, right? Much, much, much more contagious. But in this case, what COVID is called is droplet, right? It's spread through droplets, right? The little viral droplets. So the N95 mask is protective, right? But it requires that you be tested, right? It's called fit testing. They make sure the mask fits, you get a nice tight seal. And many of us in this room cannot wear that mask, including myself, because, why? Because of our beard, right? So you can't get a seal over this beard, right? And many of our beards, we can't get a seal. So we should not be wearing these masks. And part of the reason we shouldn't be wearing these masks is we have to leave it for those people who need it, right? There's a shortage going on right now. And actually, I've heard even at some of these hospitals in the city, if employees are caught stealing these masks, they'll be fired on the spot, right? So people are taking this mad seriously, because this is very, very important, right? We have to be very, very careful of using these resources for those who need it. And we've also seen people buying these masks and then price gorging on eBay and Amazon and selling it for hundreds and maybe even thousands of dollars, right? So people are trying to make money and stuff off of this crisis. We should not be among those people, right? We are supposed to be honest. We're supposed to, think about community welfare as well. So leave these masks for those people who need it. If you can even find one now. You probably can't even find one if you wanted to. So the CDC, they gave us a nice diagram of what kind of beards you can use the mask for and what kind of beards you can't, and they have all these weird names for it. For example, most of our Muslim beards are probably like a Garibaldi or a Banholz, which I've never heard of before. They have circle beard, they have chin curtains, mutton chops, toothbrush. So they have apparently all these different kind of facial styles have a name to it, right? And as you can see, there's a lot of X's here. So most of them can't wear that N95 mask. So even if you had it on, you're probably still going to get infected. It's not going to really help you. So common sense, that's really the main way to prevent getting COVID as much as you can, right? Wash your hands, right? The most common sense thing, right? How do you wash your hands, right? So first you need soap, right? Why do you need soap? Because COVID is a virus. It has an RNA code around it, and soap can actually break through that and get rid of the virus, right? So in Islam, we don't like killing things, but when it comes to COVID, we definitely want to kill that thing, right? So always use soap. Make sure you lather up really well, right? Use lots of water, or enough, don't waste water, but use enough water to make sure you have a good lather, and wash for 20 seconds, right? So that's like singing Happy Birthday or the ABC song, or maybe Surat An-Nas or something, but you probably don't want to do that in the bathroom. But wash your hands for 20 seconds, right? And you want to be very thorough, not just a quick, this kind of thing and that's it. You want to get through each of your fingers, right? So over 20 seconds, you're getting through each of your fingers, You want to make sure you get your under your nails, make sure you get soap under your nails. Same thing over here, right? All around, right? In every part of your hand, under your nails, everywhere. Because you want to make sure that your entire hand is clean. And the virus is so small, so you want to make sure the soap gets everywhere so you can destroy it. The second thing, cover your cough, right? Again, very, very obvious, very, very common sense. Sometimes the simplest things can make a huge, huge difference. How do you cover your cough, right? Do you cover your cough with the air, right? Let the air cover your cough? Definitely not. You cover with your hand? With your hand? No, you don't. Why don't you cover with your hand? Nope, not like that either. Why? Right? You don't want to shake hands, you don't want to touch random stuff and then someone else will touch it. So definitely don't cough in your hand, right? Cough in your elbow, like this, right? Just like that diagram shows, right? The proper way to cough is to cough in your elbow. And unless you're going around and touching stuff with your elbow like this, all around, you're probably not going to spread it, right? And if you are, it's going to be much, much, much more minimal than if you coughed in your hand. So cough in your elbow and make sure that you wash your hands frequently with soap for how many seconds? 3 seconds? No, definitely not 3 seconds. 20 seconds. 20 seconds. Any type of soap is fine. Yeah, as long as like the antibacterial soap that you find. Any type of soap is fine, because all those compounds in there will break down the coat of the COVID virus, the protection that it has. So we'll get to hand sanitizer, but I'll talk about it now. So hand sanitizer, there's two types, right? There's alcohol-based and there's non-alcohol-based. Right? And there's ikhtilaf whether you can use alcohol-based. I'll leave that to Brother Zakaria, inshallah, or somebody else to answer that. I don't have the knowledge on that from an Islamic standpoint. But I try to avoid the alcohol-based. But recommendations from the CDC right now are actually saying to use alcohol-based hand sanitizer for above 60% alcohol content. Right? So that's what they say, well, right now will kill it. When you use alcohol wipes, you also wipe your hands completely, in your fingers, between the digits, under your nails, and let it dry completely, right? That's the proper way to use it. But the best thing is soap and water, still the best, no matter what. And if your hands are visibly dirty, right, you have some sort of dirt on it, whatever, don't use hand sanitizer. It's not going to really do much, right? You really want to use soap and water and wash that thing off, not spread it around your hands with the hand sanitizer. So what about special categories of people? Pregnant women. Are pregnant women at risk of COVID or at higher risk of COVID? Who said yes? So maybe. So we don't know. And that's the scary part, right? So again, I'm telling you not to panic, right? And that's true, don't panic, but we still have to be wary. So we don't have enough data on pregnant women right now. We don't know if they're passing it or not. They've done very limited studies which have shown it doesn't seem to pass to the fetus. They don't seem to be at increased risk. But those studies, we can't really take them. It's not enough people, it's not enough to really know right now. So pregnant women, be careful, but there's no data showing that it's particularly more dangerous. What about kids? Are kids dying of COVID? No. So kids actually are not dying of COVID, right? They may be getting it, and when they have it, they may be spreading it. But they are not dying, and they're not getting those serious illnesses. And we don't know why exactly, but a theory is that, remember I told you that the common cold really is coronavirus, right? Or it's part of the common cold, right? So kids get colds all the time, right? They're always touching things, putting it in their mouth, they go to school and swapping saliva and all that gross stuff, right, that we hate. But they get these colds and they get sort of resistance to some of these coronaviruses. Their immune systems are developing a strength towards it. So maybe because of that, scientists are theorizing that they're more not immune, but they're not getting affected as badly by COVID. But the people we have to worry about, again, are the elderly and the immunocompromised and those who are chronically ill, right? So low immune system, chronically sick, right? Chronically sick with like diabetes, especially lung disease, COPD, emphysema, things like that. Definitely we have to worry about, and the elderly. So other precautions we should take, right? Again, if this becomes much, much bigger here in the US, I don't know if you heard in China, sorry, not in China, well in China too, China and in Italy, they've done super quarantine. In China, Italy, they've done a blockade of travel, so people can't travel throughout Italy. So that means supply chains may get cut off, right? You may not be able to get things as fast as we normally do, right? There's no Amazon Prime trucks coming to deliver stuff in 1 day or 1 hour shipping, right? So make sure you have maybe a month, 6 weeks of medications for things that are really important. right? Blood pressure, diabetes medication, stuff like that. Make sure you have a good supply of medications, right? Keep some Tylenol, keep some ibuprofen, allergy medication, Sudafed, whatever you need on hand, just to be safe. Stock up, right? I know people are freaking out and going and buying toilet tissue and paper towels, and I even heard today that they're buying underwear, right? And stocking up when you can't find underwear anymore. Don't stock up on the toilet tissue, right? We use water, we're good, right? If we don't have toilet tissue, we're still good, right? We don't need underwear, we just wash your underwear and it'll be good. But we should stock up on things like canned goods, right? Tuna fish, maybe like boxed pasta. Keep maybe a week, 2 weeks worth. Because if we are quarantined, right? If the New York State puts a quarantine on New York, if it spreads in Queens like wildfire and we can't go shopping, at least have something at home just to be safe. And the other thing is people are going to panic, right? So if it gets worse, people are going to go and raid the whole store. So be proactive, go and get some stuff right now, keep it in your house, right? Don't buy like 3 months worth of supplies, just buy a week or two and just be prepared and keep that aside in case of an emergency, right? We have to tie our camel and leave the rest to Allah. So part of tying our camel, keep our medications, keep our stock of food, clean all high-touch areas, right? All of the doorknobs, faucets, particularly if somebody is sick, right? First thing you do when you go home, wash your hands, so that way you're not touching everything with the outside hands that may have stuff on it. And your phones, right? Find a safe way to clean your phones. That's probably one of the most high-touch objects that we use every day. We go everywhere, right? We touch everything, and then we touch our phones, and we bring it home. And then our kids play with the phones, and they touch their face, and it's a whole big mess. So make sure you clean your phones as well. Right? But find a safe way to clean. Don't like start putting on the water, because I've done that before and then your phone messes up. Right? So don't do that. Avoid people who are sick. Right? Common sense advice. If someone is really, really sick, if you have to take care of them, that's one thing. But if your friend is like really coughing up a storm and you can hear him hacking on the phone and you're going to have dinner with him just to have dinner, maybe postpone it a few days. Right? There's no urgency. Right? Be safe. Especially if you have elderly people at home, people who have a low immune system, stuff like that. You want to be extra safe. And then don't touch your face, right? Very obvious, don't touch your face. And it's easier said than done. We're so used to just randomly touching our eye here, it itches, you touch your nose, right? So it's hard not to do it. You have to be mindful of it. Maybe keep your hands busy with a stress ball or something like that. Maybe do dhikr, right? If you're doing dhikr, you're not touching your face, right? And that's a good way, you get 2 benefits, right? And just try and be mindful of it, right? It's easier said than done, but if you keep thinking about it, eventually it'll become part of your routine. And then the flu shot. As I said, as of right now, you're still more likely to get the flu, right? And the flu is still deadly. As you saw on that graph, people die of the flu. And I've seen even like a 25-year-old die of the flu. It affected his heart, totally healthy, no problems. And then he died, right? His heart gave out. So people die of the flu. Old people, young people, not as much, but it does happen. So the flu is still dangerous. All of these precautions of washing your hands and covering your cough protects you against the flu, COVID, the common cold, all of this stuff. Right? Very common sense, but that's what we should be doing. Right? We shouldn't be freaking out. Right? We tie our camel, we do all of our stuff, and then we have tawakkul on Allah. And no matter what, right? The main thing to remember is no matter how bad COVID is, no matter how bad MERS is, right? All of that stuff. If Allah doesn't want us to have it, if He wills for us not to have it, we won't get it. And if He wills for us to get it, then it'll happen, right? And if it happens, then we have to thank Allah that we are patient through this test. Right? We thank Allah nothing worse happened to us. Right? And really see the positive side in things, right? As much as we can. And know that ultimately everything's up to Allah, we just take our precautions. So the main thing is don't panic, cover your cough, and wash your hands. And this is one takeaway today, is what the CDC recommended, keep calm and wash your hands. And that being said, this is all of the medical side of things. There's also things that our religion tells us about what to do. And Brother Zakaria will talk more about that part of it. As Muslims, how do we respond to this? So I'll let Brother Zakaria start, inshallah. And then after Isha, after we're finished with Isha prayer and after Brother Zakaria is done talking, we'll have a Q&A session so we can answer any questions that you have. All right, Assalamu alaikum wa rahmatullahi wa barakatuh.